Hi everyone, so I'm going to be doing my presentation on cerebral palsy in exercise. So these are just some photos of people with cerebral palsy, and then the photo on the left is a picture of me and a fellow student and our athlete that we trained for the adapted fitness program at Westchester. Her name was Kate. She was awesome, and she had cerebral palsy. She was one of the reasons I picked this topic. So here we go. So what is cerebral palsy? It's a broad term kind of used for a group of disorders that affects an individual's mobility and muscle coordination. It's damage to the brain that causes a loss of muscle control. And it means brain disease causing paralysis. And then I found this really good quote from one of my sources. And it says, though cerebral palsy can be defined, having cerebral palsy does not define the person that has the condition. So I thought that was a really good quote. So, how is it caused? It's actually a neurodevelopmental disorder, which means it's kind of a disorder that happens when the brain is developing. So, it's caused by an abnormal brain development or an injury to the brain during fetal development or shortly after birth, like up until toddlerhood. So, it's caused by head trauma, like a fetal stroke, infection, hypoxia, lack of oxygen, things like that. So the severity of the spectrum of the movement impairment. So there's actually a spectrum of the movement impairment. Like some people can walk with little to no assistance. They just have a few small problems. But there's the other end of the spectrum where they have a lot of movement impairment and they have to use a wheelchair to get around. So yeah, it's on a spectrum because it varies in severity from individual to individual, and the severity kind of depends on two things, where the damage is located in the brain or and also how much damage there is to that area. So there are 3 types of cerebral palsy. The most common type is the first one. It's called spastic cerebral palsy, and it's caused by damage to the motor cortex. It's the most common type, and it's characterized by tight and stiff muscles and something called hypertonia, which means increased muscle tone. Excuse me. And that kind of means that they're flexed all the time in certain areas of the body, and it's also called pyramidal CP. The second type is called dyskinetic cerebral palsy, which is caused by damage to the basal ganglia, and it's characterized by involuntary movements and something called dystonia, which is pretty much unusual twisting postures, repetitive movements, clenching hands and fingers. It's kind of like the opposite of hypertonia. It's like floppy, relaxed muscles. And then there's ataxic cerebral palsy, which is damage to the cerebellum. It means without order, and it's characterized by shaky, uncoordinated, and unstable muscle movements. Those people have a lot of imbalance, and this is the least common type that you'll see. So these are the other types of cerebral palsy. So the spastic, dyskinetic, and ataxic is kind of characterized by what kind of movement impairment you have. And then there's types that describe where the movement impairment is. So monoplegia is like one limb is affected. Hemiplegia is one side of your body is affected. So like your left leg and your left arm, or sometimes your right leg and your right arm. Then there's diplegia, which is, it could be your 2 arms are affected or your 2 legs are affected. And then there's quadriplegia, which is all 4 limbs affected, even your core, your neck, pretty much everywhere. And then it can even get more specific than this. It could be like 3 limbs, and that has a specific name, etc. So is cerebral palsy curable? No, it's not. It's a permanent chronic condition, so it's lifelong, and it's classified by damage to the brain, so that can't necessarily be fixed right now in the medical world. So it can't be cured, but it can be managed. So it can be managed with therapy, OT, PT, exercise, and it's non-progressive. So it's not going to necessarily get worse with age, but at the same time, it doesn't really get better, but treatment can help alleviate some of the symptoms. So common medications used, these are the medications that are kind of used to treat the symptoms associated with cerebral palsy, and a lot of them should be checked with a physician for any contraindications for exercise. So a lot of the medications that they take them for their uncontrolled body movements, their seizure medications, so like anticonvulsants. They take antidepressants sometimes to just kind of help with things like social pressures, any kind of things they're facing with their limitations that they face every day. So some of them do take antidepressants, muscle relaxers, anti-inflammatories for any pain that they may be having associated with their symptoms, and stool softeners. Because a lot of them that are wheelchair bound may want to take things like stool softeners, things like that. And actually, so some of the uncontrolled body movement medications, they can take benztropine, mesylate, Rubenol, and then some of the anticonvulsants, they might take gabapentin, trileptal, and then some antidepressants are like things like Prozac and Celexa. So can people with cerebral palsy exercise? The answer to that is of course. The amount that they can exercise, though, really depends on what kind of CP they have and how severe it is. And then the program that they need is going to be very, very specific to the individual. And so there's no evidence that says that they shouldn't exercise. And exercise can actually have a really positive impact on their muscle strength, elasticity, and range of motion. And it's actually very important to maintain their health and have a lot of cerebral palsy treatment. So some of the benefits, it can alleviate their physical symptoms, improve their strength, flexibility, and CV endurance, like I said before. It improves muscle coordination and balance, which is really important for them. You want to prevent falls as much as possible because it can be detrimental to them. And then you also want to increase their sensory integration. Exercise also improves communication, social interaction, depressive symptoms, immune system, quality of sleep, overall health, and it also improves their gait and posture. So there's no reason why you wouldn't want to exercise if you had cerebral palsy. So this is the case study I did. It's a patient that is 21 years old. He's a male with spastic diplegia cerebral palsy. So diplegia, my patient actually has his two lower limbs, his legs are, they have spastic cerebral palsy. So he has very low muscle function in his legs. He suffers from a lot of hypertonia. So he actually uses a wheelchair because of that. He is 60 kilograms in weight and 160 centimeters in height. His exercise history, he did a lot of PT throughout his school years and some light stretching at home with the help of his parents. His blood pressure is normal, 134/70. TC is 188, LDL 162, HDL is 42, and the fasting blood glucose is 120. The medications that he takes some anticholinergic medications, which helps with the uncontrolled muscle movements, and then some anticonvulsants, which are for his seizures, and then he has occasional Advil for his pain. So his risks, I put him in the moderate risk group because he has 2 or more. He has 3 risk factors, but he is asymptomatic for any CV or metabolic diseases. His 3 risk factors are his LDLs, which is 162, it's above 160. His fasting glucose is 120, that's a risk factor, and his medications. He does have seizures, so I think that's something that's important for a physician to clear, and any of their medications that he has, because I know some of them kind of have side effects, like raising blood pressure, things like that, and dizziness, drowsiness. Things that aren't risk factors for him are his weight. He's a normal weight. His exercise history, I think, would be a judgment call. I don't think that it's a risk factor, him being young and everything. His blood pressure is good as of now. His TC and his HDL levels are also fine. So his goals. He actually is able to stand and balance by himself for 2 minutes already. So his next goal for himself is to be able to strengthen his legs so that he can actually take a few steps on his own if he needs to. He also wants to improve his muscle tone in his arms. His arms have a lot of function in them, but he wants to further increase that so he can have just an improved quality of life. And he also wants to improve his balance. And then any special considerations, he is in a chair, so I think a special consideration would be to be mindful of his chair usage. I think a good exercise program would incorporate a lot of him getting out of his chair as much as possible so that he can feel more free and independent. So some exercise tests, I would say that all the aerobic and anaerobic exercise tests should be performed on the arm cycle ergometer, not the treadmill or the bike because of the low muscle function in his legs. Strength, I would say isokinetic dynamometer. I would also say maybe a 1RM bench press, something like that. And also flexibility and range of motion. I'd say use the goniometer just to kind of measure the flexibility in all of his joints. So shoulder flexion, things like that. Exercise prescription. So I'd say the frequency, I would say 30 minutes a day, preferably 3 to 5 days a week, depending on the intensity, moderate or vigorous. Moderate would be 40 to 60% VO2 max, and vigorous is greater than or equal to 60%. I would say the time depends on the intensity as well, and the type. Aerobic fitness, I would say 3 to 5 days a week. Muscular strength, 2 to 3 days a week. And because he has cerebral palsy, I would think flexibility and balance are two very important things for him. I would say to do that every day. So this is just a prescription I made for him. And I would say to progress with this program, 10% rule each week. So kind of keep increasing it as he gets stronger and stronger. I included a warm-up, a cool-down, and I incorporated a lot of upper body strength to just kind of focus on the goal he had to increase his muscle tone in his upper body. And then I did some exercises for the lower body as well so that he can reach his goal to strengthen his legs so that he can walk. And then we incorporated some cardiovascular fitness. I would say he could use the arm ergometer for a little bit just to kind of work on some cardio, and then flexibility and balance. I said PNF stretching would be good for him with like a trainer or a physical therapist. And then balance, I would say practice standing by himself for 2 minutes or longer. So the conclusion is that cerebral palsy is a chronic, lifelong, non-progressive neurodevelopmental disorder caused by brain damage that impairs muscular function. There's many different types of CP depending on what kind of movement impairment you have and where the movement impairment is located. It has a spectrum of severity. Some people can function with little to no assistance, and some people function with the use of a wheelchair. Individuals with cerebral palsy can highly benefit from exercise. It's a very beneficial method of therapy for them, like physical therapy and occupational therapy. And exercise prescription for people with cerebral palsy will be very specific to the individual because they're all very different from one another. And those are some of my references. I also used some pages in the book as well, and that is all I have for you.